Introducing the MESA Deformity Spinal System featuring RAILT 4D technology from K2M, Complex Spine Innovations. This module demonstrates a right thoracic curve correction using a differential rod correction technique. This correction technique features MESA technology. The MESA screws are low-profile implants. The screws feature zero-torque technology, requiring no torque for final locking, and when locked, have no profile above the rod. Polyaxial screws are anchored proximally, and deformity uniplanar screws are used throughout the rest of the construct. There are three basic components to the differential rod correction philosophy. First, select implants with different rigidity for the concave and convex sides. The convex rod or rail should be at least one step down in flexural rigidity compared to the concave rod or rail. This will allow the convex rod to bend during correction. Second, relative to the desired final kyphosis, the convex rod or rail should be underbent and the concave rod or rail should be overbent. The convex rod should have approximately 5 to 10 degrees of kyphosis, with a majority at the proximal end. This less rigid rod or rail will provide the push on the convexity. The concave rod should have approximately 40 to 50 degrees of kyphosis. This more rigid rod or rail will help provide the pull out of the concavity during correction. Last, this technique requires the simultaneous placement of both the convex and concave rods or rails. Placing both rods at the same time and using the MESA screws with the crickets allows the correction forces to be shared over multiple levels. Apply 4 crickets at the proximal end of the convex side of the construct. Then insert the appropriately bent rod through the crickets and loosely place the remainder of the crickets on the convex side. Starting on the concave side, place 4 crickets at the distal end of the construct. Insert the appropriately bent rail and loosely place 1 cricket at the top of the construct. Once the initial crickets are in place, rotate the rod and the rail into the proper sagittal alignment and hold in place. Slowly reduce the crickets on the convex side, working toward the distal end until the convex rod is sitting just above the inner collet of the screws. Fully reduce the bottom 2 crickets. Rotation will occur around the axis of this rod. Leaving the rod proud of the screw head provides freedom for rotation and reduces the potential friction. On the concave side, fully reduce the bottom 3 crickets and apply some reduction to the top cricket. Then loosely add the remainder of the crickets working towards the apex. Once all the crickets are applied, slowly reduce the crickets working from the outside in, moving towards the apex. Reduction is done slowly using each cricket and moving to adjacent levels to avoid point loading on any one screw. Note the vertebral bodies rotating around the axis of the convex rod as the concave crickets are reduced. Continue reducing until all the concave crickets are fully reduced. This sequence also bows the convex rod. Complete the reduction by fully tightening the convex crickets starting from the distal end of the construct. Note, at this point the rod and rail are nearly identical in contour. If compression or distraction is desired, loosen the cricket, compress or distract, and retighten. Repeat the same sequence on as many levels as desired. Finally, use the superfly to partially lock each MESA screw. Remove the crickets and final lock the screws with a quick locker to complete the construct. The MESA Deformity Spinal System from K2M, Complex Spine Innovations.